specialty is pediatrics or adults with brain tumors. So cancer is still a big problem for kids, and it's the second leading cause of death in children under the age of 15. So I think that's something that as parents, I don't know if you feel like, why me, but it's actually a common thing out there, unfortunately. Why we're doing this is the whole idea is to reduce the number of toxicities both right now and down the road. And for kids, the most important thing is the stuff that happens down the road. The Proton plan reduces that spray of radiation, and we think that's so important in kids, and that's why a lot of insurance companies are agreeing to pay. In disease sites that we're having a hard time with, we're actually reintroducing radiation at a younger age. For instance, ependymoma. For a while, we weren't treating kids under the age of 3. Now we are, because we realized without the radiation, the outcomes weren't so good. So it's one of these things where we realize we have a tool, we have to use it, and we're kind of always in this balancing act in a yo-yo of where we have to stop and where we have to kind of keep on going. So you see the blue area is less than it is down here. So this is IMRT, and you can see the blue extends down here, it goes out there, whereas the blue is really much more limited, and the higher dose is more concentrated in the Proton versus the IMRT. So this was a planning study that we did, and it's again, this is very, very good Proton planning, and this is very, very good IMRT planning. And no matter what, it seems like we're always cutting out a lot of this extra blue dose that we don't see here. And so if we're using this appropriately, we may be able to spare this here, these pink things here are what we call the hippocampus, and we think that's associated with memory. So if we can reduce the dose to those structures, then that'll provide hopefully a better outcome to patients. The number of survivors that are increasing. So we know that, we're doing better. We have to consider the long-term effects of all the treatments we do, and that's from surgery, the chemo, the radiation, everything. We want to decrease treatment volume and dose. And there's always an effort to reduce dose to as low as possible, but we realize if we're going to go down too low, we may not get tumor control. We have to educate you guys and other caregivers about all the potential side effects from all of this. So as the kids get older, they're aware of what their potential issues are and that they know to recognize them, and we can help overcome them. There is this thing called long-term follow-up guidelines at curesearch.org. I think I got the address right. And they actually, this is through an effort through Children's Oncology Group, and we've actually listed by site what particular issues need to be looked at for kids depending on what their tumor was. So if they had a knee tumor, for instance, or a leg tumor, what issues to worry about when they're 10, 15, 20 years out of therapy, brain, breast, all of that. So all of these issues, this is actually a great resource, and we need to continue collecting our data.